doctors and nurses to keep up with the demand. Hospitalizations continue to rise. If it wasn't clear before, it's obvious now that having so much still open, from restaurants to all-size indoor events to water parks, is not going to turn this thing around, which is why I continue to call for an enforceable stay-home order. There's no reason to believe that this virus will act differently because it's in Harris County, and we're seeing that it behaves no differently here. The strategy of just filling our hospital beds with sick residents is wrong. It's the wrong way to pursue public health policy. It is the wrong way to get ahead of this virus, and it's wrong morally. It's also not working. Today, teachers and parents are understandably up in arms about what all this means for going back to school. And as long as we stay this way, trapped where we are, without taking meaningful action to bring the curve down, we won't be able to move forward in a sustainable fashion. And let me be clear on this point. As we've been saying since March, we cannot just flatten the curve. We have to crush it. We have to bring it down. It's the only way out of this. As tough as this challenge is to address, there's no mystery about what we need to do right now, and that is stay home. We can't say for how long. This virus doesn't respect timelines, doesn't respond to deadlines, and that's the problem that set us up to fail in the first place, to say we want things open by Easter, May 1st, whatever it was. The numbers are startling and frightening, and we need to act. To further illustrate just how challenging this problem is, let me share some new information about the impact on our Hispanic and African American populations. This is a particular area of concern that I have and that we should all have. According to data from Harris County Public Health, in Harris County outside the city of Houston, since the middle of May, Hispanics have made up more than 50% of the weekly total cases being hospitalized. In some of those weeks, their share of total cases has been 65%. That despite the fact that Hispanics are 44% of the population in Harris County. This data is a snapshot at any given time, each given week. But even when we look at the data from every case, every hospitalization we've had, and we take that in total, the data is concerning. African Americans, when we look at the sum total of hospitalizations since March, make up over 25% of hospitalizations, despite being around 18% of the population. Hispanics make up 60% of the sum total number of COVID-positive cases, despite being 44% of the population. As weeks go by, the percentage of total cases and total hospitalizations made up by Hispanics is increasing. The good news is the percentage made up by African Americans is trending down as weeks go by. These numbers, although outside the city of Houston, mirror the numbers produced by the Texas Medical Center, which includes the city and also neighboring counties' data. There we are seeing similar stories. The zip codes that have a denser Hispanic population are those with higher positivity rates. If this isn't a wake-up call, I don't know what is. One of the saddest repercussions of this strategy to fill up all hospital beds before taking meaningful actions has been how we're leaving an enormous piece of our community behind. We should all care about what's happening to our most vulnerable residents right now, and not just because that's the right thing to do. We're all interconnected. When one part of our community does much worse, it affects all of us. If some among us are sicker than the rest of us at the moment, guess what? Sooner or later, it's going to catch up with all of us. The virus doesn't discriminate. There should be no surprise that our minority community is disproportionately impacted. Many of these folks are the folks that call my office, saying that their supervisor is making them work when they're sick, that their supervisor is keeping the business open when they know it should be closed, that they're not taking adequate precautions in the workplace as they should. Many are afraid to access care. afraid that they or family members will be deported. The virus is catching up with all of us, and we need to take drastic action now. While we continue to say we need to stay home, we are fighting this in every single front we can, using every tool at our disposal. One of these is the small business program we are unveiling today to help the smallest small businesses in Harris County stay afloat through all of this. The Harris County Small Business Recovery Fund supports businesses like a salon that's employed 10 people for 20 years, a local bakery, an auto repair shop, the corner pharmacy, and mom and pop cafes and restaurants. This $30 million grant program was unanimously approved by the Harris County Commissioner's Court. It's in addition to the $10 million program that we've already dispersed. It prioritizes small businesses that have not yet received funds from other COVID relief programs. And it prioritizes the smallest of those small businesses and the owners that have lower incomes. The program opens for applications today. We've already received 1,000. It'll stay open for 10 business days, and applications can be submitted online or via phone. At the end of the 10 business day intake period, applications will be selected at random. Program funds will be distributed to businesses operating with less than 30 employees that employ less than 30 folks, so these are very small businesses. Priorities for folks employing less than 5. The grants will be up to $25,000, and we expect to serve around 1,500 small businesses. It's important to underscore the program is not first come, first serve. So folks can apply anytime within this 10-day period, and they will be selected at random based on this waiting process. To apply, visit readyharris.org or call 713-845-2476. Small businesses are the backbone of our economy here in Harris County, and the pandemic has hit them especially hard. We in county government can't make up for all the loss, but we're doing everything we can to try and help. Their survival is not just critical to the prosperity of our region, but also to the character of our community. I know the pain so many people are going through, not just from a health standpoint, but also from an economic standpoint, the kind of business owners that are going to be turning to us for support. I wish we could just wish the virus away, but it doesn't work that way. We can't. We need to be honest enough to take the path we know will lead to sustainable success instead of a quick victory and a return to a crisis. That means staying home now, getting on the path of the communities that are reopening successfully for the long haul, who buckled down until their curve came down, who didn't give up early. We're not going to be in a place for these businesses to open successfully and for the long haul if we don't get this curve under control. And in the meantime, we're increasing hospitalizations, deaths, and hurting our community even more. So I want to thank my colleagues on Commissioner's Court for prioritizing small businesses for all of their work. Commissioner Adrian Garcia, Commissioner Rodney Ellis, Commissioners Cagle and Raddick, who also supported this program. And I'll repeat my remarks in Spanish, then we'll hear from Dr. Shah and Commissioner Garcia, followed by Commissioner Ellis. Desde la última vez que hablamos, lo que más temíamos está sucediendo. A finales de mayo, los pacientes de COVID eran un 15% de las unidades de cuidados intensivos. Ahora forman un 48% y el porcentaje continúa subiendo. Hemos llegado al límite de la capacidad base, la capacidad estándar de los hospitales día tras día. La cruzamos día tras día. Eso significa reportes de personas esperando camas en las unidades de cuidados intensivos, esas camas menos y menos disponibles, tener que importar doctores, enfermeras y esas hospitalizaciones que continúan subiendo. Parece que lo peor realmente está sucediendo. Si no era claro antes, ahora es completamente obvio que la estrategia de tener tantas cosas abiertas, desde restaurantes hasta cualquier evento, siempre y cuando sea adentro, también parques de agua. Nada de esto va a solucionar la situación. No hay razón, no tenemos ninguna indicación que el virus se comporta de una manera distinta aquí en el condado Harris. La estrategia de simplemente llenar las camas hospitalarias, a ver hasta dónde podemos extender esa capacidad de los hospitales, es una mala estrategia. No es una buena dirección ni estrategia de salud pública. Tampoco es la manera correcta de adelantárnosles y ganarle a este virus. Está mal por el punto de vista moral y obviamente no está funcionando. Hoy día entiendo muchos profesores, maestros, padres preocupados. ¿Qué significa esto cuando estamos diciendo que se van a abrir las escuelas o está diciendo eso el Estado? Siempre y cuando sigamos con esta estrategia estaremos atrapados. No vamos a poder bajar la curva, no vamos a poder salir adelante de una manera sostenible. Y hay que ser claros en este punto. Desde marzo hemos dicho que no se trata simplemente de aplanar la curva, sino de bajarla, de completamente ayudar a que podamos salir adelante, a que podamos aplastar esa curva y después de ahí poder seguir de una manera más sostenible. No es un misterio lo que hay que hacer, es quedarse en casa. No podemos decir por cuánto tiempo, porque este virus no responde a fechas límites. Ese fue el problema en marzo, cuando se decía que hay que abrir para la Pascua, para el 1 de mayo, todo esto, y finalmente fue una situación crisis nuevamente. Para ilustrar más el reto que está proponiendo este problema, déjenme compartir un poco de información acerca del impacto a las comunidades latinas y afroamericanas. Esta es un área donde he estado yo bastante preocupada y todos debemos estar prestando atención a este tema. De acuerdo a datos del Departamento de Salud Pública del Condado Harris, en el Condado Harris, fuera de la ciudad de Houston, desde mayo, los latinos han sido más de 50% de la totalidad de hospitalizaciones semanalmente, semana tras semana. En algunas de esas semanas, el porcentaje ha subido hasta el 65%. Eso aunque los hispanos forman simplemente el 44% de la población del condado. Esta información es simplemente una semana a la vez. Pero si vemos a todos los datos de cada caso, cada hospitalización que hemos tenido desde marzo, la totalidad de los casos y la totalidad de las hospitalizaciones, vemos que los afroamericanos forman más del 25% de las hospitalizaciones, aunque son el 18% de la población. Los latinos forman el 60% de la totalidad de los casos positivos, aunque somos simplemente el 44% de la población. A medida que pasan las semanas, el porcentaje de casos totales y de hospitalizaciones totales que son de hispanos está incrementando. La única buena noticia es que el porcentaje de afroamericanos se está reduciendo a medida que pasan las semanas. Estos números, aunque vienen fuera de la ciudad de Houston, reflejan también los números que está produciendo el centro médico, el cual incluye la ciudad y varios condados vecinos. Están viendo que los códigos postales, donde hay un gran porcentaje de hispanos, tienen una tasa de positividad de más del 50%. Si esto no nos despierta, si esto no nos demuestra que hay que tomar acción, no sé qué lo va a hacer. Uno de los impactos más tristes de esta estrategia de llenar todos los hospitales y ver qué pasa es que estamos abandonando una enorme proporción de nuestra comunidad. A todos nos debe preocupar qué le está sucediendo a los residentes más vulnerables y no solo porque es lo correcto, todos estamos conectados. Cuando parte de nuestra comunidad está sufriendo, finalmente nos afecta a todos. Si algunos están más enfermos que los demás en este momento, tarde que temprano, eso nos va a alcanzar y nos va a ganar. El virus no discrimina. No es sorpresa que la comunidad latina se vea impactada de esta manera. Estas son las personas que están llamando a mi oficina a decirme que el jefe los obliga a trabajar cuando ellos no se sienten cómodos, cuando están enfermos, que el jefe no toma las precauciones necesarias, que están abiertos los negocios que deben estar cerrados. Muchos tienen miedo de acceder cuidado, les da miedo que ellos o la familia puedan ser deportados. Entonces este virus ya nos está alcanzando, nos está ganando y hay que tomar acción ya mismo. A medida que seguimos pidiéndole a la gente que por favor se quede en casa, seguimos luchando en todos los frentes, utilizando todas las herramientas a nuestra disposición. Una de estas herramientas es el programa para pequeñas empresas que estamos lanzando el día de hoy para ayudar a las empresas más pequeñas a lo largo de nuestro condado. Este fondo apoya empresas, adicionalmente son $30 millones en adición a los 10 millones que ya ha comprometido el condado para ayudar a las pequeñas empresas. Ayudaremos negocios como un salón de belleza que ha empleado 10 personas por 20 años, una panadería local, un taller de reparación de automóviles, farmacia de la esquina, y cafés y restaurantes familiares. La idea es ayudar al menos 1.500 negocios. Abren las aplicaciones el día de hoy, estarán abiertas por 10 días hasta el 24 de julio a las 3:30 de la tarde. Las aplicaciones las puede llenar por internet en readyharris.org o puede llamar al 713-845-2476. Al final de los 10 días, las aplicaciones van a ser seleccionadas al azar. Entonces, este programa no es en orden de llegada. No se preocupe por apurarse a enviar su aplicación. La prioridad irá para los aplicantes que no han recibido ya fondos de otros programas del gobierno y también para los negocios más pequeños. Se priorizan los negocios con 5 empleados y los negocios donde los dueños sean de bajos recursos. Los fondos son de hasta $25,000 por negocio. Las pequeñas empresas son realmente el centro de la economía en nuestro condado y esta pandemia las ha impactado de una manera enorme. Sabemos que solo este programa no va a solucionar el problema para todas estas pequeñas empresas, pero en el condado haremos todo lo posible por ayudar. Entiendo el dolor que muchas personas están pasando. No solamente el dolor por punto de vista de salud, de estas empresas que estarán acudiendo a nuestros fondos, sienten ese impacto económico que tantas familias están sufriendo. Me encantaría poder decir que si simplemente esperamos que el virus se vaya, se va a ir, pero así no es. Sabemos lo que hay que hacer. Tenemos que ser honestos y tomar el camino que sabemos va a llevar a un crecimiento sostenible, a una reapertura sostenible de la economía. No podemos simplemente intentar tener una victoria rápida y a las semanas o a los meses regresar a una crisis. Lo que hay que hacer en este momento es quedarse en casa hasta que baje esa curva. Lo hemos visto en muchas comunidades a lo largo del país y a lo largo del mundo. Ya que la curva caiga, ahí sí se puede abrir de una manera más cuidadosa, con rastreadores, con pruebas. Pero hasta que hagamos eso no va a ser posible. Más van a sufrir estos negocios, más va a sufrir la economía, más va a sufrir la comunidad. Entonces, por eso tenemos que trabajar juntos, tener una estrategia a largo plazo y ser honestos con lo que estamos proponiendo. Quiero agradecerles a mis colegas, al comisionado Adrián García, quien ha liderado esto, comisionado Rodney Ellis y también a los comisionados Radek y Cagle, quien apoyaron este programa. Entonces, con eso hablará el Dr. Shah y después van a hablar los comisionados. With that, I'll pass it on for brief remarks to Dr. Shah, and then we'll hear from Commissioner Garcia, who's led these small business programs, Commissioner Ellis, and finally we'll take questions. Everybody here is available for questions. Thank you. Dr. Shah.
Thank you. Thank you, Judge. My name is Dr. Umair Shah, the Executive Director and the Local Health Authority for Harris County Public Health, and I want to thank Judge Hidalgo, Commissioner Garcia, Commissioner Ellis, Representative Wally, or the county leadership for your continued support. And I want to just underscore a few points that are very important right now, that our community remains in a critical situation when it comes to COVID-19 response. We are continuing to see an increase in cases. We are seeing an increase in hospitalizations. As the judge mentioned, we're also seeing what's most concerning is increases in our ICUs. I also want to underscore the fact that we're also seeing an increase in the in the percentage of the tests that we're doing in the community that are coming back positive. That is a key concern for us from a public health standpoint, and I wanted to make sure to underscore that as well. The critical situation is obviously underscored by the policies that are in place that we're all trying to work with the state to give us the opportunity to really fight this pandemic as best we can with the community together alongside us. And the second thing is really about individuals and the behaviors that we've all underscored before, and that includes everything from staying at home, wearing your face coverings, washing your hands, avoiding any gatherings, getting tested, and ensuring that we're remembering that testing is the foundation of everything that we are asking our community to do as part of the COVID-19 response, and certainly just making sure that people are watching and monitoring and keeping up with their general health with sleep and all sorts of other reasons to be physical health and vitamins and all sorts of things that people need to do to stay healthy. This is a virus that is going to be with us for some time, and we need to make sure that we're all strong as we fight this virus together. I want to also underscore what the judge mentioned, that we are seeing the increases in our Hispanic population when it comes to both cases and hospitalizations. Judge has already provided the information around both the Hispanic population as well as our African American population. I just want to underscore this is a significant concern for us at the Public Health Department. While all of us are in this together, while all of us and all of our messages go to the entirety of our community, we particularly want to speak to our Hispanic and our African American community. The concern that we have is that the increases in the Hispanic community are not just a cumulative increase, but it has actually gotten worse over, as the judge mentioned, over time. And we know that some of those factors may be related to uninsurance rates. They may be related to many in our Hispanic community are working frontline jobs and the economics of what's occurring with this pandemic, as well as multifamily households. And certainly we are concerned about fear and stigma in our community. And we want to make sure that our Hispanic community and our African American community, that all of us together remember that we are fighting a virus, but we also have to recognize we're in this together, which means do not fear, do not have the concern that you cannot get tested, do not have the concern that you cannot go to a healthcare provider, do not have that concern, because that is absolutely the wrong way to fight this virus. We need to all be in this together. We are focusing a lot of our efforts at the Health Department on our disproportionately impacted communities. That includes ensuring that we are focusing attention in those communities. Commissioner Garcia, Commissioner Ellis, and other county leadership, along with Judge Hidalgo, we've really been working together to make sure that we are reaching into the community. Bilingual outreach, and I wanted to talk about that for just a moment. We have made at the Health Department over close to actually about 10,000 calls and contacts into the small business community, the faith community, the schools and other places where we have tried to really get to where the core is of outreach and engagement. We've also done everything we can to work with partners who are in the Hispanic and the African American communities so they can be champions of that voice and of reason and also of fighting this pandemic. Test sites have also been very much, in addition to our 2 large FEMA sites, and you may have heard that there looks to be an extension through the end of July for those 2 test sites, the announcement that came this weekend from the governor. In addition to that, we have been doing mobile testing, that Harris County Public Health has been moving test sites along with all of our precincts to various parts of our community, and we're also looking at where we have disproportionately impacted communities to make sure our testing is also located geographically there. And finally, our materials in not just English, but Spanish and a variety of languages really are allowing us to really get information into the community in a fact-based manner. But I can't underscore enough what the judge mentioned, that this is really about all of us together. We are at a critical time in our community. All eyes are on Texas. All eyes are on Harris County. We have to continue to step up. We did this earlier in the response, and we were successful. Unfortunately, now the numbers are increasing in a way that it's going to require all of us to work together. So there are things collectively that we can do in communities and neighborhoods and with our families. There are also things that individually each of us can do. And again, staying at home is the #1 thing that I want to emphasize, is we have started to see people wearing the masks outdoors and even indoors, but we want to emphasize, if you do not need to go out, do not go out. It is not something that should be taken lightly. It is absolutely critical in fighting this pandemic. And certainly, please get tested. And I wanted to remind everybody, readyharris.org, readyharris.org, or call 832-927-7575. As you may have noted, it is hot outside. We've had to shift our hours. We've had to make some changes in our operations at Harris County Public Health for our testing sites, as have other communities across this region, as we've been trying to respond to both the pandemic as well as the heat. We want to keep our community safe as they're coming for testing. We also want to keep our workers safe as they're providing the mission work for the community. But at the end of the day, we need everybody to be thinking about what they can do to help us continue to fight this pandemic. And with that, I'm going to turn it back over to the judge. Thank you so much.
Commissioner Garcia.
Thank you, Judge. Commissioner Ellis, Representative Wale, thank you all for your respective support in making this Small Business Recovery Fund a reality. As the judge has already mentioned, this is in addition to the $10 million that we have done previously. Those $10 million are almost all entirely dispersed throughout Harris County. We're very excited that those have gotten to the hands of the businesses that have needed the assistance. And this is all accentuated by I just read a Chronicle story this morning talking about the impact of the pandemic on our local industries. And the fact that we are on a slight economic recovery, but when you are in the valley of the impact of this pandemic, that recovery is not where it needs to be, nor is it as strong as it needs to be. And so I'm excited at the fact that Harris County has led. And if you also recall, our previous $10 million program was voted on by the three of us. This one was voted on by all members of Commissioners Court, and I am grateful to Commissioners Cagle and Raddick for joining us in our efforts to help save local small businesses, mom and pop shops, those businesses that in all likelihood would employ a kid that's on vacation during the summer. It would be someone employing a local parent who doesn't have a vehicle but can walk to their business. These are the businesses that we have strived to help, and these resources couldn't get to them soon enough. But similarly to the first $10 million that we dispersed, and with these $30 million, $10 million, $30 million, $40 million in total, in anybody's pocket would be a lot of money. But the reality of it is, in the $10 million, we saw 7,000 applications. In the $10 million loan program, we saw 10 million or 7,000 applications needing $152 million. That was just an indication of the pain that this pandemic has caused economically. 30 million, we've already gotten, you'll hear more about that, 1,000 applications as of this morning. And so over 10 days, we will see thousands more for a program that we hope will be able to support 1,500. But it is not lost on us, on Harris County, and this is why I'm proud of my colleagues for us leading in the endeavor to support our local economy, our mom and pop shops, our small businesses. We've always said that small businesses are the backbone of the economy. Well, Harris County has the backs of our small businesses. And for that, I'm incredibly proud and grateful to be a part of that effort. Also, I want to make mention that the $10 million program initially was a loan program, or it was announced as a loan program. This is a grant program. We are currently working, we're not there yet, but we're working and believe that we will be able to effectively convert the loan program into this grant program so that every business that we have been helping will have consistency in how we do the work and support across. I didn't want to have one group of businesses under one set of criteria and another group under a different set of criteria. So this will effectively become a $40 million program that we are executing as we speak. And I just want to close with this, that Judge Hidalgo, I couldn't be more grateful for your leadership, whether it is on the scientific front of this pandemic or on the economic side of this equation. Your leadership has been strong, it has been visionary, it has been forthright, it has been truthful and transparent. And so I'm grateful for your leadership. Quiero estar aquí esta mañana para anunciar que hoy estamos anunciando los 30 millones de becas que vamos a ofrecer a empresas pequeñas alrededor del condado. Como saben, comenzamos este esfuerzo para apoyar y rescatar a nuestras empresas pequeñas alrededor del condado con 10 millones que se hizo en abril. Esos 10 millones fueron aplicados por 7,000 empresas alrededor del condado, pidiendo alrededor de $152 millones de dólares. Entonces, eso es una indicación de la presión, del daño que nuestra economía ha sufrido. Y ese daño no está perdido en el liderazgo de este condado, comenzando con la jueza Hidalgo, el comisionado Rodney Ellis y mis colegas Raddick y Cagle. Esto es importante porque siempre hemos dicho que las empresas pequeñas son la mera fuerza de nuestra economía. Entonces queremos mostrar que los respetamos y reconocemos lo que ellos ofrecen a nuestra economía, lo que están haciendo, y es importante que nosotros también llegamos a respaldarlos con estos recursos que tenemos. Y para también reconocer que el primer programa de 10 millones fue un préstamo. Estos 30 millones es una beca, pero estamos trabajando para convertir el préstamo a una beca para que tenemos todas las empresas trabajando con los mismos criterios y para asegurar que todos están pasando por el mismo procedimiento. No quería tener tantos empresas bajo un préstamo y otros bajo una beca. Entonces, ahorita estamos trabajando para hacerlo constante a través de los proyectos que estamos desarrollando. Entonces, estamos viendo que 40 millones de dólares es lo que este condado está ofreciendo a nuestras empresas pequeñas. Esto es importante porque sabemos que las empresas pequeñas son las mismas empresas que le van a dar un trabajo a un niño que está en sus vacaciones durante el verano. Son las mismas empresas que le van a dar un trabajo, un empleo a una madre que vive en la vecindad, no tiene carro, pero puede caminar a su trabajo. Esas son las empresas que realmente hacen nuestra economía trabajar, funcionar, y queremos apoyarlos lo tanto que se puede. And I just also want to thank our county leadership, because Harris County is demonstrating that the CARES money that we have received, we are working tirelessly to put it to work, to move our county forward and get it out of this pandemic sooner rather than later. Y me da mucho gusto que nosotros, con el dinero que hemos recibido, lo estamos poniendo a trabajar para ayudar, movilizar nuestro condado y sacarlo de esta pandemia lo más pronto posible. Gracias. Thank you, Judge.
a good friend of ours used to have a picture on his wall of Sam Houston, and he had a great quote, and it was, "Do right and suffer the consequences." Judge Hidalgo, when I think of that, I think of you, because that's what you've done. During this crisis, you have focused on science and not simplicity. You focus on policies and not politics. And my friend, you certainly got to scorn of a few people for doing that. But I want to commend you for your leadership. Dr. Shaw, I'm so glad both of you made reference to the disparities, and I'm sure we'll talk about it more tomorrow. I can't help but think hospitals are losing money. In Texas, we've lost $10 billion a year for 13 years. That's $130 billion just because we won't take the money from the Affordable Care Act. A lot of our constituents, who I tell you ought to get tested, sometimes say to me, "Why would I get tested? I can't get in a hospital. I don't have health insurance." So we got to make sure we focus on that. Well, my reason for being here today, Commissioner Garcia, is to commend you. You're right. We always say small businesses are the backbone of the community. They're about 50% of the jobs in our economy. And make no mistake about it, our economy evolves on the basis of spending. Unfortunately, generally, it's spending money we don't have. But that's how our economy evolves. I want to commend Commissioner Garcia for stepping up with $10 million, having no idea when the three of us voted for it, where it would come from. In fact, we assumed we'd have to take it out of our rainy day fund. But if you couldn't justify that being an emergency, to hit that emergency fund, what would be? And I want to commend you, Commissioner Garcia, because you helped us learn lessons from the first go-around. On that federal money, our minority and women-owned businesses were still at the back of the bus. Many of the smaller businesses were on the back of the bus. So as the judge said, this is not first come, first served, because sometimes the better prepared or the most unfortunate are the ones sitting there by the computer waiting to go online and grab the money. We know that even with this 30 and that 10, 40 is not enough. I want to encourage the MWBEs, the other small businesses, encourage our other partners, City of Pasadena, all of the cities that are getting federal CARES money, including our partners at the City of Houston, to consider doing something along these lines as well. In addition to us focusing on businesses, we also focusing on people. We took $30 million, which may well have to come out of our emergency fund, because we want to make sure when we did the direct payments, we hit everybody. We're going to let the money go to where the money came from, including our immigrants who pay sales taxes, who pay property taxes, who pay income taxes. And then we're going to add a little more to that at some point that may come from the federal CARES Act money. But it's important. We know it's not enough. On that other fund, on direct assistance, I think we had to turn down 450,000 people. So there's a lot of need out there, and we're doing as much as we can. We're not taking this CARES money doing what some people around the country are doing. They're filling in holes that are created in the local budgets as a result of the pandemic. We know, in addition to funding our basic services, people who make this economy evolve are hurting as well. Last point. Commissioner Garcia, I'm so glad this go around you decided to let the entity administer this that was on the edge of your old city council district and the edge of my old city council district. They come a long way since I think that $10 million in federal money to develop a Palm Center. So my last task is to introduce someone I knew when he was telling me about guayaberas. And then explain to me why I ought to buy a few. He was an intern around the Capitol many years ago. I knew him when he was a student, state rep, and he's gotten promoted. He is a czar, Armando Wale.
Thank you, Commissioner Ellis, Commissioner Garcia, Judge Lina Hidalgo, Dr. Shaw. Thank you, and I'll be brief. Armando Wale, State Representative from House District 140 in the North Houston unincorporated area. And so I just wanted to thank all of you guys for the work that you've done at City Council, at Commissioner's Court, particularly on $30 million to help small businesses in a very calculated and a very precise program so that we help small businesses get some bridge funding, particularly to stave off, in some cases, Commissioner, to stave off bankruptcy for many of our local and small businesses. I have a lot of those, taquerias, panaderias, mom and pop machine shops, but we know that there is a lot of pain going on, particularly in our small businesses organizations, and we want to say that from the county perspective, this is something that will hopefully, in our view, and I know that the goal of the commissioner is to provide some bridge funding, but the county, particularly on CARES Act resources. And so with the CARES Act money comes a lot of responsibility, and I think that the responsibility that and the forthright of Commissioner's Court has been on point in targeting these CARES Act dollars to the most vulnerable populations, such as our small businesses. So one of the things I'd like to talk about real briefly is back in 2009 when we had the Great Recession, and I was a first-term member of the legislature, we took about $12 to $14 billion in federal money, and unfortunately, we supplanted those dollars. Instead of putting state money into those in public education, when we cut public education close to $5 billion, we used federal money to plug those holes and did not provide any additional revenue for those schools. It wasn't only until recently that we were able to, with the passage of HB 3, plug a little of those holes that we've had in public education. Last thing I'd like to talk about particularly is to those members of our community, particularly our Latino communities that need assistance. Don't be afraid to call to get tested. It's very important that you get tested, particularly in our Latino and African American communities, because there's a disparate impact on those communities with this virus. And so I want to say lastly, we need to adhere to the health experts and Dr. Shaw with that. I'd also call on the governor to give us the tools back that we need, to give the county the tools back that we need. We have plenty of tools in the toolbox that work. Unfortunately, at the state level, those cords have been cut. And so give those tools back, give that power back to the local government so that we can ride, unfortunately, these bumps that we're experiencing now in higher hospitalization rates, higher infection rates. And so that would be my urge to the governor, is to give local counties the authority that they need to combat this virus. And with that, I'll close and answer any questions that folks might have.
Thank you so much. Thank you, Representative. And Representative Wally has been driving so many of our efforts around recovery, so I appreciate everything you're doing, you and your team. We'll now take questions.
Okay. Judge, do you foresee a second shutdown with the situation that we have right now?
I've been saying already for a few weeks that we need to stay home, and all we've achieved by not having a stay-home order for the past few weeks is more hospitalizations, more deaths, more pain in our community, and we're not any closer to putting our economy back on track. Quite the contrary. The longer we wait, the longer it'll take to recover. And so, if what we're waiting for is more tragic data, more tragic stories, there you have them. We have the stories of folks waiting in the emergency room for an ICU bed. We have the data showing 60%, 50% of hospitalizations from the Hispanic population, even though they're about 44% of the population. We know that some businesses are open seemingly only enough to spread the virus, but not enough to sustain them. And the concern in the community about how schools could possibly go back at such a high level of infection. As long as we continue to pretend like we can reopen the economy safely, while being at surge hospital capacity, while having an enormous pool of cases that will spread the virus, we are simply trying to make policy based on wishful thinking. And it really is about time we get honest with ourselves and we take this into our own hands, work on the processes and the policies that we know are effective from other states and from other countries.
There is another question for Telemundo. ¿Nos puede decir si esta ayuda va a ser suficiente ante la gran necesidad que hay para las pequeñas compañías y si piensan abrir una segunda ronda?
Esta ayuda son 30 millones de dólares, esperamos ayudar unas 1.500 empresas y ya el día de hoy, el primer día, tenemos 1.000 aplicaciones. Entonces, obviamente no será suficiente, sabemos que el dolor económico en las pequeñas empresas es enorme. Siempre estamos explorando qué más ayuda podemos ofrecer. En este momento estamos desarrollando un programa para inquilinos, para que pueda apoyarles al pagar la renta. Ya hemos invertido 30 millones de dólares para individuos, otros 10 para pequeñas empresas. Entonces, seguiremos explorando qué se puede hacer, pero realmente la herramienta más poderosa que tenemos es el aplastar esa curva, trabajar juntos para que baje esa curva, para poder controlar las infecciones, las hospitalizaciones y ahí sí reabrir de una manera sostenible para ayudar a todos esos negocios a largo plazo. No podemos pretender que el gobierno local va a poder rescatar todas estas empresas. Lo que hay que hacer es poner a la economía en una posición de ser exitosa. Entonces, de eso se trata la estrategia que hemos visto en otros estados, en otros países, y hay que trabajar juntos para aplanar la curva y aplastarla, bajarla. No podemos simplemente seguir con estos parques acuáticos, restaurantes, todo abierto, hasta que se llenen los hospitales. Esa no es estrategia económica, no es estrategia de salud tampoco.
En caso de que sea necesario, ¿se contaría de nueva cuenta con ese espacio del Energy Park para poder atender a la población de que fuera necesario?
Así es, está disponible nuestro refugio médico de Energy. Ese refugio es pues la última opción y son camas de población general del hospital. Entonces, cuando se abre ese recurso es cuando los hospitales están teniendo que convertir sus camas de operación general, las están teniendo que convertir en camas de cuidados intensivos, entonces se están quedando sin camas para temas no de cuidados intensivos. Ahí se activaría ese refugio. En este momento todavía no estamos en esa situación, pero lo que sí estamos viendo es que hay mucho límite en el acceso a las camas de cuidados intensivos. El sistema no es perfectamente eficaz y ya se está llegando a tope. Entonces estamos pendientes, está ese recurso en stand-by, se puede activar en 72 horas.
Next question is for Commissioner Garcia. Thank you, Judge. The question is, how can business benefit from this? How can business benefit from this?
How can businesses benefit from this? Well, you know, we ask that everyone who needs help to get through this pandemic, if you have 30 employees or less, please apply. The idea is to give an injection into our economy, to strengthen it, to help them keep their doors open and to keep their employees on the payroll. As much as we want to flatten the pandemic curve, we want to flatten the unemployment curve. And I believe that these resources will help people get through that next stage as more people gain confidence in being able to get around safely. But by the same token, anyone who benefits from these programs, I ask that you pay it forward. I ask that you do work with other businesses in your community. Help us all leverage this money as much as we can throughout the county.
The next question for you is, what is different with this grant program as compared to before?
They're almost virtually the same, with the exception that the previous one was structured as a loan program, meaning that if they did not meet certain conditions, they would be required to pay it back. The grant program is much more flexible. It has much more opportunity and less obligations on area businesses. We do want them to stay open. There are some expectations in that regard. So one has much more stringent reporting requirements, things of that nature. That would be under the $10 million loan program. A lot of that will be resolved once they're merged together.
La pregunta aquí en español.
Oh, yeah, and also that the first 10 million was a first come, first serve. And so the difference between the two is that under this, under the $30 million program, as the judge alluded to, that you don't have to rush today to get your application in. You can get it in Wednesday or Thursday or Friday, and you'll still have a good chance to have your application reviewed and potentially approved.
The next question in Spanish for Telemundo is, comisionado, ¿nos puede hablar de la necesidad que hay en su distrito y si sabe de algún ejemplo que si no recibe esta ayuda podría verse forzado a cerrar?
Pues mira, tengo desgraciadamente muchos ejemplos de empresas que están a riesgo de cerrar. Ya hemos visto varios cerrar en el precinto 2. Y hay que recordar que, como ha hablado la jueza, de la infección que está sucediendo dentro de nuestra comunidad a nivel del pandemia, también es de la infección que tenemos dentro de nuestra economía. Entonces, espero que este proyecto, estas becas, vaya a ayudar a rescatar a las empresas en nuestra economía, que les va a llegar a dar un empuje para sobresalir la pandemia. Y esperamos que esas mismas empresas lleguen a trabajar con otras empresas alrededor de su comunidad para poder hacer seguro que este dinero va a trabajar para no solamente salvar el que recibió el dinero, pero también para apoyar a aquellos que no han recibido el apoyo.
Gracias, comisionado García. La siguiente pregunta sería para el representante Waller. Si nos...
¿Por qué no hace la pregunta y yo miro quién
claro
lo
que sí.
responde? Sí.
¿Podrá este préstamo ayudar a negocios que se vieron forzados a cerrar recientemente? Y si reciben esta ayuda, ¿podrían volver a abrir sus puertas con esta ayuda?
Sí, este fondo está disponible para empresas siempre y cuando hayan estado abiertas durante todo el año del 2019. Entonces, si han estado activas todo el año del 2019, pueden aplicar a este fondo y son hasta $25,000.
Perfecto. Serían todas las cuestiones que me enviaron los demás medios.
Bueno,
Gracias.
sí quiero dejar claro, I'll do it in English and also in Spanish. I do want to make very clear for the community that any Harris County testing sites, they are not asking for insurance. The tests are free. They are not asking for citizenship, and it's without charge. And so those are the testing sites folks can visit through readyharris.org, and we encourage folks to get tested. Same goes for our Harris Health hospitals, our public hospitals. Folks can show up at the hospital with COVID, no need to have insurance, and please visit our public hospitals if you have a need. We are seeing reports of folks who don't go to the hospital when they need to, and that's a big challenge for our community, and we want to make sure we're taking care of you. But remember, what we really need to do is stop pretending like filling up our hospital beds is a morally adequate, economically adequate, or adequate strategy from a health standpoint. En español, repito, quiero invitar a todas las personas que necesiten una prueba a presentarse a nuestras sedes de pruebas del Condado Harris. A través de readyharris.org pueden registrarse. Esas pruebas son sin costo alguno. No se le pide seguro médico y tampoco se le pide ciudadanía. Ni siquiera se les pide identificación. Simplemente necesitamos una manera para poderlos contactar. Entonces, por favor, háganse la prueba. También los hospitales públicos del sistema Harris Health no le pedirán seguro ni ciudadanía. Puede acudir allí si tiene coronavirus o un tema respiratorio, entonces por favor preséntese. Hemos recibido reportes de personas que no se están presentando al hospital cuando necesitan ir y queremos ayudarlos, pero también recordar que es simplemente falso e inapropiado por punto de vista moral, punto de vista económico, punto de vista de salud, el simplemente seguir con todo abierto hasta que se llenen las camas hospitalarias. Entonces seguimos pidiendo a todos que por favor se queden en casa, salvo actividades esenciales. Gracias, solo quería decir eso. Thank you so much. Thank you. Thank you. All right.
All right, Judge Lina Hidalgo there and her team. Originally, this press conference was called to talk about the new small business program, another $30 million from the county for very small businesses to help them survive this pandemic. But she led off with these new numbers and percentages of minority communities that have been affected by COVID-19 and their percentage testing positive in the hospitals and such. So the county judge there just saying this is unsustainable and again calling for another shutdown in Texas. And she's been calling for this for some time, as has the mayor. You just heard, though, late last week, the governor actually, for the first time, suggests that that may need to happen if this continues the way it's going, with not only a high number of cases in the state, but also a higher positivity rate of the people tested. So that percentage is going up, and that is very concerning. And of course, a lot of ICU beds are full, and that number continues to rise as well. We will wrap this up for you here in less than an hour. The news at noon with Sherman Chow. Hope you can join us then. Of course, I'll be back for the 411 this afternoon at 4 o'clock. You can stay in touch anytime, khou.com, or download the KHOU mobile app, and that will let you know anytime one of these press conferences happens. We can send an alert right to your phone so you can tune in and see the entire thing if you wish. I'm Russ Lewis. We'll see you here in less than an hour.
Now, Pumpkin, even in the face of a damn near tragedy, then some good has come out.